According to the CDC, about 12% of women in America struggle with infertility.
Yeah, it is Infertility Awareness Week this week, and we have Dr. Deirdre Conway here with Utah Fertility Center and Fresh Living's Kami Stroot to shed some light on infertility and support options, the science behind it all, and things have progressed so much. But how many Utahns struggle with fertility?
I think it's maybe even higher here. It's about 1 in 6 nationally.
Yeah.
So it's like a huge epidemic that a lot of people really don't talk a lot about.
You know, how you just asked how common
Yeah.
it is, but at what point should people start to seek help if they're experiencing infertility?
Yeah, that's a great question. And it does depend a little bit on everybody's situation. I think it's also important to think about the fact that humans are not that fertile to begin with compared to a lot of mammals. It's about a 20% chance of conceiving per cycle. So it does naturally take some time, but for most of us, if we've been just trying and not using protection for about a year or so, it's always a good time to even just meet with your OBGYN or talk to somebody and get some testing done. But in general, if women are, especially in couples where the female partner is 35 or older, it's a good idea to get a little testing earlier in the process just to make sure everything's okay. And sometimes it's just like peace of mind, and then we'll tell them to try even a little bit longer, but usually about 6 to 12 months.
Okay, and Kami, you shared your story with us about your struggle with infertility. When did you decide to get help?
Well, it's funny. I know we don't always talk about our age on camera, right? I don't want to give too much away here, but she says the number 35, and they say it's geriatric, so I'm close to that.
Yeah.
And everyone knows on Fresh Living, I have a 5-year-old son, and it took us a while of, just not protecting and having fun and enjoying being married. And after about 4 or 5 years, we were like, I think something might be broken. So I did exactly what she did. I went to my OB. We had a test called an HSG test, where they kind of just making sure everything, the fallopian tubes are working properly, and everything looked great. And we were fortunate enough to get pregnant with Kai. Everything was wonderful. And then kind of fast forward, we knew it took us a while for Kai.
Right.
So we started when he was 6 months old. So fast forward to over 4.5 years later, he's over 5. Let's say about 2.5 years into that. I knew I had talked to my OB, just like Dr. Conway had said, if you're trying for over a year and you're not having success. So we went back in, and I think the biggest thing is I was just scared to pick up fertility. We'd all seen the drugs of the needles and all the process. Yeah. That was my biggest thing, is I was just scared to pick it up. And so now going through this, I'm not as scared anymore. That's what's really cool about my journey.
Okay, and I think, what's the first thing you test?
I think it's just all the things. You're just wanting to find answers, right?
And
I think that's the first step.
Fertility as well.
Yeah, it's actually fairly equal opportunity. So, when somebody comes in, they don't need a referral. Although I think a lot of people are scared, so they'll go take some baby steps with their OB, but they can come straight to us, and it's just finding those answers. It's actually about 50-50 male versus female factor issues, and sometimes it's issues with sperm numbers or quality, and things that we can even treat the underlying problem. And about 50% of the time, it's female factors. It could be ovulation issues, problems with your anatomy, and doing that testing, looking for sperm issues, and anatomic issues and ovulation problems are probably the most common things we see. And about 20% of the time, it can be unexplained infertility. After we do all that testing, we just don't have the exact pinpoint answer, but there's also really good treatments for that as well.
And you mentioned being kind of scared and nervous. I'm sure so many people relate to that. Are there any misconceptions about infertility and preventing people from going to make that first appointment? And what would you say to them?
I think, yes, many misconceptions. I think one is that stress causes infertility, because people get so wound up, because it's just like you spend your whole life kind of trying not to be pregnant. People talk in high school. And then all of a sudden you can't conceive, and it's just paralyzing, and it's so scary and intimidating. And I think you get wound up, and then people stress that their stress is actually causing infertility, and just go on vacation, which sometimes works. Yes. Usually not, and just relax. But really there truly is generally a biologic reason that someone isn't able to conceive. So that's where it just comes back to trying to find those answers so that you can feel empowered to have then options to treat those issues.
And I imagine emotionally you kind of feel like you're failing. You're a failure.
Oh my gosh,
you don't want to admit you failed at something.
Well, and I think with social media, and obviously it's so in our face, and our phones are so smart. Like you're talking about pregnancy, it's all right there in front of you, and I swear every 30 seconds someone's getting pregnant, and you're going, I am trying. And so many people would say, stop picking it up. just go have fun. And I'm like, I am doing that. Like, I am just not worrying about it. And it is, you know, for us, not to throw my husband out there, but we had, like, he has more of a condition that with like a lower sperm count. And so that made it a little bit harder. And so there was some like tests that I would do, and I'd be like, oh, they'd say, oh, your uterus is textbook perfect.
You're fine.
Yeah, like, oh my gosh, your lining is amazing. So I'm like, what is happening here?
Well, and there are so many more treatments available now, high tech stuff
Yes.
that you can do. It's incredible.
True. Yes. I mean, I think it's good to know that I would say probably 2/3 of our patients are actually able to get pregnant with things that are less aggressive than the advanced technologies like in vitro, with just ovulation, medications, issues with sperm factor problems can be treated easily. But yeah, for those 1/3 to 1/4 of our patients that need IVF, it is an amazing technology that gives people very high chances of success. It's way better than it was, 20, 30 years ago.
Wow.
That's great to hear.
Okay, thanks so much. Utah Fertility Center, where are you and how can people get a hold of you?
We
or
are-
do you need to have a doctor refer you?
Nope, no referral needed. You can come straight to us, just utahfertility.com, or call us, 801-785-5100. We're all over the Wasatch Front, many offices.
Awesome.